The next time you have a surgery or procedure, you may receive a different type of pain reliever. Journavx was just approved by the FDA. It's an alternative to opioids because makers say it's not addictive. Family Dr. Nita Bijoor is joining us now. She's from Oakview Medical Associates here in Greenville. Thanks for joining us today.
Thank you for having me.
And I know a big thing you wanted to discuss first is safety of pain relievers as well as the benefits, because there is some benefits to taking them, not suffering. Right. So let's first talk about that. When we treat acute pain, what are the safety concerns?
So there are a lot of safety concerns. First of all, you want to use something that's not addictive or doesn't cause over-dependence, over-reliance on the medication. Side effects is a big one. A lot of the traditional opioids are sedating. They can cause liver damage, and so they have really serious side effects. Tolerability is a big factor, making sure that they can tolerate them well and they don't build up tolerance. That's a big issue. Then you need escalating doses of medications. Some of them can cause respiratory depression and just also mental side effects, depression, cognitive fog. So those are really important safety concerns with a lot of the current pain medications out there.
A lot of the opioids.
Right.
Now, you say there are some benefits to treating acute pain. Can you explain that?
Absolutely. For acute pain, like if you were to have a fracture or post-surgical, post-surgery, it's really important because it helps the pain pathways. If we suppress those, then the patient is able to recover better, has a better understanding of their pain. We don't want to over-suppress pain signals either because it can mask infection, it can mask other things. So you have to find an appropriate multimodal approach to pain management right after surgery. So it also helps faster recovery. Patients are able to mobilize themselves, and prevents chronic pain as well.
So let's next talk about this new medication that's available, Journavx. How does it work?
So it's brand new. It inhibits the receptor there's a specific receptor in the pain pathway that it inhibits and thereby lowers the pain signal for the patient. So it's used mainly for acute pain.
Would you say it's just as effective as an ibuprofen, or how does it compare to other pain medications?
I think in the studies they compared it to placebo and hydrocodone acetaminophen, which is kind of one of the traditional pain medications, and they found that it was more efficacious and pretty good in relieving acute pain.
Okay, so it works. I mean, I think that's what people really want to know. Are there any side effects we need to know about it?
As with others, I think the concern is because it's not an opioid, is it going to also cause addictive or dependence potential? And that, let's see, as the clinicians start using it more and more, we need real life data to help us with that, but supposed to be pretty well tolerated. We'll just see how it pans out.
Yeah, I think I read it up on the studies and it said it was tested on a couple hundred people.
Right.
But again, you really need it to be given to millions of people to really see what any side effects could be.
That's right, because we have patients with multiple chronic conditions, and so when we introduce a medication, we're always monitoring and educating our patients, so safety comes first.
All right. Well, we look forward to seeing how effective it is and having another option besides opioids.
Absolutely. I think hopefully we're excited about it. So.
All right. Thank you, Dr. Bijoor.
Thank you.